Okay guys, so in the last couple of modules we've talked about the different type of psychotherapies that are out there. There are a lot of different therapies, but the big question is, do any of them really work? So there's a couple different ways that we can try to figure out if psychotherapies are effective. One way is to flat out ask the client themselves, like, do you feel as though this helped you? So we can ask the clients, do you feel like you're better off after therapy than you were prior to actually receiving it? When we ask clients these questions, there's strong supportive testimonial evidence. However, there are a couple things that we need to keep in mind. When someone seeks out treatment, it's usually because they're experiencing some type of a crisis. Crises don't last forever. And as we'll see in a minute, most people will improve over time regardless of whether or not they actually receive any treatment. We also have to be wary of the placebo effect. The placebo effect is where if you think something is going to help you feel better, that alone may actually help make you feel better. Clients also have a tendency to speak kindly about their therapists. They've spent money and time with these individuals. To speak poorly of them would mean that they wasted their time or their money, so they usually have a very positive attitude towards those individuals. Clients want to believe that the therapy that they received is worth the effort. This is a biased recall. It's called effort justification. I want to make sure that if I spent time away from my job or my hobbies or my family or my pets or whatever, that it was worth it. And so, of course, I'm going to want to believe that it was effective. Another way that we can try to determine whether or not therapy is effective is we can ask the client, or the clinician, to judge whether or not they felt the therapy was successful. Most clinicians will point to successful case studies where they say, hey, you know what, this individual came to me and they were experiencing this, this, and this, and then whenever they left, this is how they had improved. However, we also have to remember that individuals come to clinicians, again, when they're kind of at their worst, and they justify leaving by saying that they feel better. The other thing is, in order to justify leaving, and in order not to create conflict, because most people aren't really super into conflict, the client may indicate to the clinician, oh, hey, I'm doing a lot better, when in fact maybe they aren't. Maybe what they have actually done is gone to seek out a different therapist. The original clinician is going to have no way of knowing this. They're being told that what they did was successful, and they're going to believe that what they did was successful. Another way in which we can look at the effectiveness of psychotherapies is through outcome research. It is estimated that 75 to 90% of people feel that psychotherapy has helped them. However, we have to remember that with or without psychotherapy, 2/3 of people will improve over time. And that's because, like I said earlier, crises don't last forever. You may not be able to see a way out of it while you're in the thick of it, but it doesn't last forever. In order to try to determine scientifically whether or not psychotherapy is effective, we can use a statistical measure called a meta-analysis. This is a statistical procedure for combining conclusions from a large number of different studies. What have these found? They have found that those undergoing therapy are more likely to improve and to do so faster and with less risk of relapse. Additionally, the longer a person stays in therapy, the greater the improvement the person makes. Psychotherapy may also be cost effective. Individuals who do not seek out psychotherapy use more sick days at work, may have more unpaid time off of work, and oftentimes have increased medical bills that are really the side effects of problems that stem from psychological issues. So which type of therapy works best? And the answer to that is there is not one therapy that is necessarily superior to any other. What we do know is that the more specific the problem is, the more effective the psychotherapy happens to be. So how do clinicians know which therapy to utilize? Most clinicians use what's called evidence-based practice. So they take into account what research says works to solve a particular problem. They also take into account their particular expertise, like what they have found works, and then also what the patient happens to prefer. The patient has to have a say in their own therapy. One who doesn't like to take medicine should not be encouraged right off the bat to take antidepressant drugs, for example. There are some therapies that have a tendency to be more effective to treat particular problems. For example, cognitive and cognitive behavioral therapy works best with anxiety disorders, PTSD, insomnia, and depression. Behavioral conditioning therapies work well for very specific behavior problems, phobias, compulsions, marital problems, and sexual dysfunctions. Psychodynamic therapies work well for depression and anxiety, and client-centered counseling works well for mild to moderate depression. So, what about alternative therapies? These alternative therapies are sometimes called pseudotherapies. They are therapies that are kind of touted as being psychological in nature, but they don't have any scientific research to back them up. However, people will take case studies of, oh yeah, you know what, I tried this and it made me feel better, and they'll use that as evidence. You have to remember that case studies do not equate evidence. Like, anecdote does not equate with evidence. So we also have to keep in mind that people have a tendency to improve over time regardless of whether or not they receive treatment. So with these pseudotherapies, is the improvement due to the natural progression of time and that natural tendency to improve, or is it a result of actual therapy that they received? And again, we also have to keep in mind the placebo effect. Just if someone believes that what they are receiving is going to help them, oftentimes they will improve. For many of these alternative therapies, there's not really a lot of evidence either for or against utilizing them. But we have to utilize them with caution because something that is unproven may not be helpful, and in fact it may in some instances be harmful. So 2 examples of these alternative therapies that are still debated in the psychological community. One is called eye movement desensitization and reprocessing, sometimes just referred to as EMDR. This is an exposure-based therapy that is sometimes used to treat PTSD, phobias, or other anxiety-related disorders, although mostly it's used with PTSD. What occurs during this is you imagine traumatic scenes while triggering eye movement. So you're asked to recall the scene that causes you the trauma, the anxiety, etc. And then a therapist will move their fingers right in front of your eyes, causing your eyes to move to the left and to the right rapidly. The goal here is that you're going to unlock and reprocess those previously frozen memories. And the idea behind it is that the eye movement helps with that reprocessing. I have a video for you that really better helps to explain EMDR. It's kind of, it's something that's a little bit difficult to conceptualize. So what's the conclusion regarding EMDR? Well, it seems to work better than not obtaining any therapy at all. However, it could simply be a combination of exposure therapy and the placebo effect. Another type of debated therapy is light therapy. This is oftentimes used to treat seasonal affective disorder. This is exposure to intense light during the winter months. Once again, this is not really fully supported by research. However, there is some scientific basis to the idea that it might spark activity in the brain that helps influence the body's arousal and hormone levels that would help to stave off depression. So how is it that psychotherapies help? Well, regardless of the type of therapy that you utilize, there are 3 basic benefits. First and foremost, it gives you the expectation and the hope that things can and will get better. That alone lifts a tremendous stress and weight off of a lot of people's shoulders. It also offers you potentially a fresh perspective. Someone else may be able to offer you a degree of insight or lead you to that degree of insight that otherwise you would not have obtained. And it provides you with a system of support. We have to keep in mind, though, that different individuals are going to seek help for different things, and they're going to seek help from different clinicians. Cultural differences matter. Different cultures, different ethnicities, different religions, different genders even, may make it very difficult for a therapist to understand the exact nature of their client's problem and for the clients to benefit from the therapies that are designed to meet their needs. We know that the emotional bond that exists between the client and the therapist is probably the most important factor when it comes to effective therapy. So what about finding a mental health professional? You should, without a doubt, seek help if you have feelings of hopelessness, deep and lasting depression, self-destructive behavior, disruptive fears, sudden mood shifts, thoughts of suicide, compulsive rituals, or if you are hearing and seeing things that others do not. This gives you a chart explaining the differences between different types of therapists and the training that they have received, so that you can understand, a psychiatrist is one who has gone through medical school and they will be able to prescribe medicine. A psychologist may have a PhD, but they are not going to be able to prescribe medicine. So knowing, different therapists and how they've been trained can help someone pick the therapist that is best for them. Next time we'll take a look at some of the biomedical therapies that are out there, and I hope you all are having a safe and happy weekend.